Welcome to our deep dive on the comparison views within the Smile Survey dashboard. We'll go ahead and hop into the dashboard over on Tableau Public, also navigable from the Arcora Foundation Smile Survey webpage. The Smile Survey has been conducted for the last 30 years by the Washington Department of Health, who has routinely monitored the oral health of children using this assessment, the Smile Survey. The data in this survey is primarily presented from the most recent survey period of 2023 to 2024, with some comparisons to the survey that was done in 2015 and 2016. To dive into the comparisons views in more depth, we'll click on the comparisons navigation across the top of the bar and see two subgroups pop up. First, a tab for demographic comparisons, and second, a tab for looking at data across counties. Let's look at the demographic comparisons first. Here, we select an individual single county. We've selected King County, for example. And on that individual county, we can then go and analyze data to compare findings and outcomes across different groups. When we look at our different information at the top in this gray box, you'll see some text that describes what you can do with this dashboard, as well as information about additional data caveats or constraints. For example, data being suppressed when there were small numbers or unstable estimates. We only include data for second and third graders combined to ensure the sample sizes are large enough to run the summary statistics for these individual subgroups within a county. As you look down the filters, you can see options for making different changes to the display. First, you can select different kinds of chart types. By default, when you arrive on this chart, you should actually see a bar chart. This bar chart displays information across various different subgroups, and when you hover over any of the bars, you'll see additional information and detail. You can look for dots, these circles at the end of the bars, to denote where there are statistically significant findings, either compared to the county estimates or compared to each other or a reference group. As we go ahead and we look across these various different groups, another way that we can analyze and look for where there are significant findings is by looking at the dot plot with the confidence interval, or CI. This plots individual findings as individual dots, and we can look for where the confidence intervals overlap or not. For example, here on household income, we can see that the two different findings for King County, 72% of low-income students having decay experience compared to 47% of not low-income students, have confidence intervals, or the gray bars indicated here, that don't overlap, which indicates a significant difference between the two groups. We also can make additional filters and changes to this dashboard by selecting different metrics and plotting results in different ways. But let me highlight one more option for you as you go ahead and navigate through this dashboard, that you can actually combine the confidence interval from the dot plot with the bar chart itself and see that data plotted with a bar chart with confidence intervals. For the sake of illustration and looking at our metrics, let's go ahead and go back to our dot plot with confidence intervals. If we want to look at this data and perhaps narrow down our focus only to some of our decay metrics, removing the metrics like needs dental treatment indicated in orange and dental sealants indicated in blue, and perhaps adding in an additional metric for rampant decay, we can then customize the view to show different key metrics from the survey. This allows you to build a customized view that can be as simple as picking a bar chart with only one metric. Say, for example, we want to only focus on sealants and tell a positive story of the share of children who are being protected with dental sealants. As we make these selections, you'll see the charts dynamically change and see different information. We also have the option to go ahead and change who we're plotting the data for. Maybe you don't want to look at data across all of the different demographic breakouts and want to focus instead only on some of the focus measures, like looking at data across household income, race, ethnicity, and homelessness as a group that may influence access to dental care. We also leave the total bar in view in many of our charts to create a point of comparison. Here, for example, being able to see that 41% of second and third graders in King County have dental sealant. We then can go ahead and see how those numbers stack up against other charts as it plots our overall bar chart. Down in the bottom of the panel, you can also see additional information about the trends over time. Here, seeing comparisons between different groups. For example, looking at untreated decay and the change for non-English speakers between 2015 and 2024. Where various different comparison measures are not available, either the specific aggregation or grouping was not available, or the survey was not conducted for that specific county for that past year. Next, let's go ahead and click on the counties comparison. Here we can dive in and we can see a lot more detail on the statewide changes between the two different survey points, as there's statewide numbers from across both points. As we look at the comparisons tab and then dive into the county level comparisons, here, instead of focusing on one single county and looking at different demographic outcomes, we're instead looking across many counties and comparing the outcomes across those counties to each other. You'll see here that we're able to select various different accountable communities of health to narrow down our focus. We could unselect all of them, for example, and only select the choice counties, and you'll see that the various different charts are responsive to that data. The data on the bottom reflects data that's been filtered. So you saw that the charts actually disappeared, for example. That's because at the top, we automatically filter to all of the data across counties. You'll see statewide findings here at the bottom. If you'd like to see the trended information for an individual county, you can click on one of the individual bars, and you'll see that the actual charts below filter to show you the available trends for that specific county. For example, if we click instead on dental sealants for Thurston County, we'll see that we see data at the bottom for Thurston County. And you'll see that it changes in the title as well, so you'll know what you've actually selected. Down below, you can see you can also customize this chart at the top in different ways. You could change the chart, for example, to go ahead and add or remove additional metrics. For example, if I only want to focus on metrics that are around issues of decay and needing dental treatment, I could remove the checkbox for dental sealants. I also can filter and look at data for different grades in this view. For example, filtering down to only second graders. You'll see that, again, because of the fact that we're looking at demographic data, we keep our aggregation for the line charts at the second and third grade combined level. Wherever we can, we've tried to include text indications of which different filters have been selected, for example, putting second grade in the title, and add additional information or reminders on the actual tooltips themselves. When in doubt, hover over a data point to find additional insights around how to interpret that point. We hope that this overview has been helpful with enabling you to use the comparison views in different ways. Again, thinking about the demographic comparison view as a way you can look at data for a single county, compared to having the county comparison view, which lets you make comparisons across counties.